Good morning, student. Today's topic is hemoglobin, competition number 6.12, and today's subtopic of discussion is types of normal and abnormal hemoglobin derivatives. So first I will explain you what is meant by hemoglobin derivatives. Hemoglobin derivatives are formed when any of the external ligand combines with heme part or the oxidation state of iron has changed from ferrous to ferric state. So it is written here, hemoglobin derivatives are formed by a combination of different ligands with heme part or change in the oxidation state of iron. Now examples of hemoglobin derivatives are oxyhemoglobin, dark red color, deoxyhemoglobin, purple color, methemoglobin, dark brown color, carboxyhemoglobin, cherry red color, sulfhemoglobin, green color. So these are the different types of hemoglobin derivatives. Now we will see which are normal hemoglobin derivatives and which are abnormal hemoglobin derivatives. Normal hemoglobin derivatives means which are present in normal adult. First is oxyhemoglobin, means when oxygen combines with the hemoglobin. Deoxyhemoglobin, when hemoglobin delivers its oxygen to the tissues, then H plus ion combines with hemoglobin, which is called as deoxyhemoglobin. Then methemoglobin, when ferrous iron is oxidized to ferric form, then it is called as methemoglobin. Up to 1% of methemoglobin is normal, but if its concentration increases above 1%, then that condition is called as methemoglobinemia, which is an abnormal condition. So it is a abnormal hemoglobin derivatives. So in abnormal hemoglobin derivatives I have written carboxyhemoglobin, sulfhemoglobin and methemoglobinemia. First is oxyhemoglobin. Iron is in ferrous state. It has double negative charge and hence it is more negative than deoxyhemoglobin. It is dark red in color. The function of oxyhemoglobin is it delivers oxygen to the tissues, and this oxyhemoglobin is diagnosed by a instrument called as spectroscope, and the method is called as spectroscopy. Deoxyhemoglobin, again iron is in ferrous state. It is single negative charge on hemoglobin because H plus combines with hemoglobin. So double negative charge on hemoglobin is converted into single negative because of binding of one H plus. So that H plus will neutralize one negative charge. It is purple in color. It binds with H plus ion. Just now I have told you. And so it acts as a buffer. Normal concentration of deoxyhemoglobin is less than 5% of total hemoglobin. If the level of deoxyhemoglobin in the body increases above 5%, it leads to a condition called as cyanosis. It is also diagnosed by spectroscopy. In fact, all hemoglobin derivatives can be diagnosed by spectroscopy method. Next is methemoglobin. In this case, when ferrous iron is oxidized to ferric form, methemoglobin is formed. In normal blood, only 1% of methemoglobin is present. It does not carry any oxygen, or you can say when hemoglobin is converted to methemoglobin, it loses the oxygen binding capacity. It is dark brown in color. Now normally methemoglobin is regularly formed in the body, but that methemoglobin is converted into normal hemoglobin with the help of a system called as methemoglobin reductase enzyme system. So this system converts the methemoglobin into normal hemoglobin. Now there are three different types of such systems are found in our body. First system is called as NADH cytochrome P5 system, which convert 95% of the methemoglobin into normal hemoglobin. Next system is NADPH cytochrome B5 system, which convert 20% of the methemoglobin into normal hemoglobin. And third one is glutathione dependent methemoglobin reductase system, which account for conversion of 5% of methemoglobin into normal hemoglobin. So in this figure I have shown you the first system, which is NADH cytochrome B5 system. I have told you about 75% of reduction of methemoglobin to hemoglobin is done by this system. So here see hemoglobin on the left side, left upper corner, where in which the iron is in ferric form. Now when this hemoglobin comes in contact with cytochrome B5, this cytochrome B5 also possesses iron in ferrous state. So this iron of cytochrome B5 donate its electron to ferric iron of hemoglobin and convert it into ferrous form. So in this way the methemoglobin is converted into normal hemoglobin. But during that process the cytochrome B5 is also oxidized. The iron present in it is converted into ferrous to ferric form. Now this cytochrome B5 is reduced by a coenzyme called as NADH. So this NADH donates its electron to cytochrome B5, in which iron is in ferric state, and convert this ferric iron of cytochrome B5 into ferrous state. In this way cytochrome B5 is regenerated and the cycle repeats. Next is NADPH cytochrome B5 system. Here 20% of the methemoglobin is converted into hemoglobin by this system. Here the same cytochrome B5 plays an important role in converting the methemoglobin into normal hemoglobin, but this oxidized cytochrome B5 is reduced with the help of coenzyme NADPH. In the previous case the coenzyme NADH is responsible for conversion of ferric form of iron in cytochrome B5 to ferrous form. Here instead of NADH, NADPH is the coenzyme. Next is glutathione dependent methemoglobin reductase system, which is account for rest of the 5% activity of conversion of methemoglobin to normal hemoglobin. Here glutathione itself donates 2 hydrogen atom or 2 electron to the ferric form of iron in hemoglobin and convert it into ferrous form, so that methemoglobin is converted into normal hemoglobin. Due to this glutathione is oxidized, and this oxidized glutathione is further reduced back by the coenzyme NADPH. So in this way the methemoglobin is converted to normal hemoglobin in normal persons. If any one of the system is affected, then conversion of methemoglobin to normal hemoglobin is also affected, and the concentration of methemoglobin in the body increases, leading to a disease called as methemoglobinemia. So this is methemoglobinemia, increase in the methemoglobin concentration in the blood. It is marked by decreased oxygen binding and transport capacity of blood. Therefore patient have cyanosis. Cyanosis means bluish discoloration of skin and mucous membrane. This presence of methemoglobin in the blood is diagnosed again by spectroscopy. The causes of methemoglobinemia are congenital or acquired. These are the congenital causes of methemoglobinemia. Here presence of hemoglobin M. Normal hemoglobin is hemoglobin A. If in some person due to some defective synthesis of hemoglobin hemoglobin M is present. This hemoglobin M also causes methemoglobinemia. Hemoglobin M and methemoglobinemia are different. And second cause is deficiency of cytochrome B5 reductase system. Just now I have told you 3 types of systems are available for conversion of methemoglobin to normal hemoglobin. It is characterized by cyanosis from birth, congenital methemoglobinemia. 10 to 15% of hemoglobin may exist in the form of methemoglobin. Normally it is 1%. Now, treatment includes oral administration of methylene blue 10 to 30 mg per day or ascorbic acid 200 to 500 mg per day. This may decrease the methemoglobin level up to 5 to 10% and cyanosis is reversed. Now what is methemoglobin M? In this point, mutation occurs leading to replacement of proximal or distal histidine by tyrosine amino acid. To understand this, you should know the structure of hemoglobin. Just in short, we will revise the structure of hemoglobin. In the center part, you are seeing the heme and peripherally it is lined by globin chain. Now see the attachment of iron. First, iron is attached to the 4 pyrrole rings nitrogen atoms. Fifth attachment of iron is directly to the proximal histidine, and sixth attachment of iron is to the distal histidine through oxygen. If this proximal histidine or distal histidine is replaced by tyrosine due to point mutation, then the iron will not form a bond with this new tyrosine molecule. So it is written here, due to point mutation, replacement of proximal or distal histidine by tyrosine amino acid. Therefore, iron has only 5 bonds. Normally it is 6, it makes 6 bonds. So when iron is pentavalent, then it readily oxidizes its iron from ferrous to ferric form and methemoglobin is formed. So hemoglobin M is, in hemoglobin M there is replacement of proximal or distal histidine by tyrosine, due to which the iron from ferrous state is converted into ferric state, and when it converted to ferric state we call it as a methemoglobin. After completing the congenital causes, we will see the acquired causes of methemoglobinemia. First is intake of water containing nitrates, which oxidizes ferrous into ferric form. Aniline dyes. These are important for the workers who work in these dye factories. Here the ferrous iron is oxidized to ferric form. There are some drugs which also convert the normal hemoglobin into methemoglobin, like acetaminophen, phenacetin, sulfanilamide, amyl nitrate, sodium nitroprusside. The next cause is glucose 6-phosphate dehydrogenase deficiency. Now this enzyme is required for synthesis of NADPH. And what is the role of NADPH here? So this NADPH is required for conversion of oxidized glutathione to reduced glutathione. Also NADPH is required for conversion of oxidized cytochrome B5 to reduced cytochrome B5. So whenever there is deficiency of NADPH in the body, the conversion of methemoglobin to normal hemoglobin is hampered. Remember, this enzyme glucose 6-phosphate dehydrogenase is responsible for synthesis of NADPH. Next hemoglobin derivative is carboxyhemoglobin. Here heme part of hemoglobin binds with carbon monoxide to form carboxyhemoglobin. The affinity of carbon monoxide to hemoglobin is 200 times more than that of oxygen. Hence, when carboxyhemoglobin binds with the hemoglobin, that hemoglobin or carboxyhemoglobin is not suitable for oxygen transport. It has cherry red color Again, it is diagnosed by spectroscopy. When one molecule of carbon monoxide binds with one monomer of hemoglobin molecule, it increases the affinity of other hemoglobin subunit towards oxygen, so that other subunit do not donate the oxygen to the tissues. This can be understood by seeing this figure. So this is a hemoglobin molecule. It has 4 subunits, 1, 2, 3, 4. Here you are seeing carbon monoxide has bind to one subunit, and for other 3 subunits oxygen has bind. Now when carbon monoxide binds to one subunit, then it increases the affinity of other remaining 3 subunits towards oxygen, and hence this hemoglobin molecule when goes to the peripheral tissues, the remaining 3 subunits which has bind to the oxygen, but they does not deliver their oxygen to the tissues. So this is the effect of carbon monoxide poisoning. Therefore, availability of oxygen to the tissue is decreased, leading to hypoxia. Carbon monoxide poisoning. Carbon monoxide is a colorless, odorless, tasteless gas generated due to incomplete combustion. Causes of carbon monoxide poisoning: breathing of automobile exhaust, mine workers in the deep part of earth, carbon dioxide is released. So due to breathing of this carbon dioxide, these workers may have carbon monoxide poisoning. Also, this carbon monoxide poisoning is seen due to breathing of partially burned organic compounds, particularly in closed spaces. The carboxyhemoglobin level in normal person is 0.16%. An average smoker has 4% of carboxyhemoglobin level. One cigarette liberates 10 to 20 ml of carbon monoxide in the lungs. So carbon monoxide level increases in smokers. Clinical manifestations of carbon monoxide poisoning. These are seen when carboxyhemoglobin level increases above 20%. The symptoms are breathlessness, headache, nausea, vomiting, and pain in the chest. If the level of carboxyhemoglobin increases from 20 to 40 to 60%, death may result. Now, how will you treat this patient? Such patients are treated with administration of oxygen, or in severe cases, oxygen under pressure, which is also called as hyperbaric oxygen, is also given to these patients. Next is self-hemoglobin. When oxyhemoglobin binds with hydrogen sulfide, self-hemoglobin is formed. Causes mainly the drugs which releases this gas in the body: phenacetin, acetinolide, dapsone, etc. Self-hemoglobin is green color hemoglobin. It is also diagnosed by spectroscopy. It is seen as basophilic stippling of RBC throughout the lifespan of RBCs. So this is about normal and abnormal hemoglobin derivatives. Thank you very much.